As you're learning more about Medicare, there are two key pieces that you want to know right from the beginning. That is Medicare Part A and Medicare Part B. It's often what's referred to as original Medicare, or the foundation for when Medicare was started. Now, these two key pieces of Medicare are what's referred to as Part A and Part B. We'll discuss Part A first. So Part A is what's called your hospital coverage. Now, Part A does not have a monthly premium as long as you've worked for 10 years or 40 quarters and paid taxes on that money. Now, when you see that red and blue Medicare card, often Part A is the main one that comes up right away. That is when individuals turn 65. If you have paid Medicare taxes for those 10 years or 40 quarters, then there will be no premium for that Part A coverage when you turn 65. Now, the other side is a little more tricky in if you want to sign up or not when you turn 65. Now, Part B is your doctors or specialists and so forth. Now, Part B, as we'll look at this chart below, has a monthly premium in 2022 of $170.10 per month. But if we notice, depending on our income, it could go up to $578.30 per month, depending on what income level you are in. So you want to take a look at your tax income statements from 2 years ago and to see if you're filing individually or filing jointly, as that will determine what your premium will be. And it's important that you take a look at that, as those two numbers can be quite a big difference in value. So you want to make sure you're aware of that ahead of time. Now, with that Part B, because there is that monthly premium, we'll put $170.10 per month just as a baseline or for an example that we can use. So with that Part B comes $170.10 per month premium. So you're going to want to ask yourself, if you're still working, is A, if you're going to stay on your employer coverage, or B, if you want to go on Medicare. And there's a few things that can help you with that determination. The first off is obviously how much you're paying your employer for that coverage. The second aspect is how good of coverage do you have at your employer. Depending on the answer to those questions, then that will determine if you'll want to go on full Medicare. Another key aspect that could play is if you have a spouse that is younger than you, that you want to wait until they're 65 as well, as they're currently under your health insurance coverage. But for this example, let's say you're ready to go on full Medicare. So that means you'll want to sign up for Part B, and you could plan, depending on your income, of having a monthly premium of $170.10 per month. Now, your window for signing up for these two is what's called an IEP, or your initial enrollment period. That is a 7-month window, and it begins 3 months before the month you turn 65, the month of, and then 3 months after. But I always recommend to my clients that they start as soon as possible, as to avoid any delays or any hassle that may come forth. But that is what's referred to as original Medicare. So just to recap, original Medicare has two parts, Part A and Part B. Your Part A is your hospital coverage. As long as you've worked for 10 years or 40 quarters, you will not have to pay a monthly premium on that amount. The other side is Part B, which is your doctor visits. That does have a monthly premium to start of $170.10 per month. So you're going to want to see if it's something you want to go on full Medicare or if you want to stay on your employer coverage. But that is base Medicare and the two main pieces that you want to learn as you start your Medicare journey. And when you get that red and blue card, it'll have both your A and B start date on there along with the number.